You know that feeling? You're just touching your neck and whoa, you feel a little lump. And your mind immediately starts racing, right? It's super common, but it can be really unnerving. So in this explainer, we're going to pull back the curtain on that lump. We're diving deep into the thyroid gland to figure out what it means when it swells, how doctors actually check it out, and what you really need to know. All right, let's get into it.
So first things first, before you even think about tests or doctor's visits, there's one key telltale sign that really separates a thyroid lump from all the other random bumps and things you might feel in your neck. What is it? What's that one single clue that points right to the thyroid? And here it is. It's surprisingly simple. It moves when you swallow. See, your thyroid gland is physically attached to your voice box, your larynx. So it makes sense that any lump on the gland has to go along for the ride every single time you swallow. If you feel a lump and it does that little up and down dance, that's a huge sign it's tied to your thyroid. Okay, so you found a lump and it moves when you swallow. The next logical step is a trip to the doctor. But what are they actually doing when they're feeling your neck? Trust me, it's not just random poking. There are very specific, tried and true techniques they use to get the full story. A doctor's exam is actually pretty methodical. For instance, they might ask you to push your head back against your hands. That tenses up the muscles and makes the thyroid gland pop out a bit more, making it easier to feel. Then they'll often gently push the whole gland to one side so they can examine the other half, or lobe, without anything in the way. They might even use just their thumb to feel for really tiny nodules while you're swallowing. Every move has a purpose, all designed to map out the gland's size, shape, and texture.
Now, here's a word you're going to hear a lot: goiter. It sounds a little old school, doesn't it? But all it means is any kind of enlargement of the thyroid gland. It's a catch-all term. It can mean one single lump, a general all-over swelling of the gland, or even a gland that's full of lots of little lumps. All right, so we know what a goiter is and how a doctor checks it out. But that brings us to the million-dollar question: what's actually causing it? Let's break down some of the most common reasons your thyroid might be swollen. And here's the good news. Most of the time, a goiter is not cancerous. A lot of the time, it's a multinodular goiter, which can be linked to something as simple as not getting enough iodine. Sometimes it's what we call a physiological goiter. The gland just gets bigger because the body needs more hormones, like during puberty or pregnancy. And other times, it's due to inflammation from autoimmune conditions, like the very common Hashimoto's thyroiditis. But of course, there's a reason doctors take these lumps so seriously. And it really boils down to this number. When a doctor finds a single, solitary thyroid nodule, it has about a 5 to 15% chance of being malignant or cancerous. Now let's flip that around. That means the vast majority, up to 95%, are totally benign. But that risk, however small, is exactly why every single lump gets a careful workup. So how do doctors begin to sort this out? Well, they're like detectives looking for clues. The real red flags: a lump that feels rock hard, is growing really fast, or shows up in someone very young or over 45. A history of radiation to the neck is another big one. On the flip side, the features that suggest something benign are a softer feel and a history of it being there for a long, long time without really changing. Now, in those cases where it is cancer, it usually falls into one of three main buckets. Papillary is by far the most common type. We're talking 80% of cases. It tends to spread locally to the lymph nodes in the neck. Think of it as taking the local roads. Follicular is different. It's more likely to get into the bloodstream, the highway system, and travel to distant places like the lungs and bones. And then there's medullary cancer, which is much rarer and comes from a totally different type of thyroid cell. You see, a thyroid lump isn't always just a local problem. If it gets big enough, it can actually start putting pressure on all the other important structures packed into your neck. And let's not forget, the thyroid is the thermostat for your entire body. So any problem can send your hormones and your metabolism haywire. When a goiter gets really big, it can start to crowd things out. Doctors have all these cool signs they look for. They'll check if your windpipe has been pushed off to one side. And get this, there's a test where if you raise both your arms, your face can get red and flushed. That's a sign the goiter is so big it's blocking blood flow from your head. Even just a hoarse voice can be a clue, suggesting the nerve to your vocal cords is being stretched. And then there's the hormone side of things. An overactive thyroid, hyperthyroidism, is like turning your body's engine up to 11. You get a racing heart, weight loss. A doctor might even feel a literal buzzing sensation over the gland from all the extra blood flow. But an underactive thyroid, hypothyroidism, is the opposite. It's like turning the thermostat way down. You feel cold, your skin gets dry, and here's a classic one, you might even lose the outer third of your eyebrows. These are huge clues about what the gland is actually doing chemically.
Okay, for our last section, we're going to dive into something really, truly fascinating. Sometimes a lump in the neck isn't in the thyroid gland at all, but is actually a leftover from its incredible journey when you were developing as an embryo. So meet the thyroglossal cyst. When your thyroid is first forming, it actually starts at the back of your tongue and travels down into your neck. Usually that path it took disappears, but sometimes a little piece of the trail gets left behind and forms a cyst. And because that path is still connected way back to your tongue, this cyst has a very cool party trick. The lump moves up when you stick your tongue out. And in even rarer situations, that developmental journey just never happens. The thyroid tissue never makes the trip down the neck. It stays right where it started, at the back of the tongue. This is called a lingual thyroid. It's not just a remnant, it's the actual functioning thyroid gland, just in a very, very strange place. And this is the part that will blow your mind. For about 70% of people who have a lingual thyroid, that little lump of tissue at the back of their tongue is the only thyroid gland they have. That's it. Their entire body's metabolism is being run from that one tiny misplaced spot. It's an absolutely stunning reminder of how wild our biology can be. So after all that, what do we walk away with? The big takeaway is this. A lump in your neck that moves when you swallow is the crucial first clue that it's your thyroid. But from there, the story can go in so many different directions. Understanding the whole picture, from the doctor's exam to all the potential causes and red flags, is the absolute best way to replace that initial fear with clarity and worry with informed awareness.